have a lot to say about Medicare, and really what I have to say is far more than you could absorb in a 50-minute time period. I'm going to be throwing a lot out there. Those of you who already know something about Medicare might fill in some of your knowledge gaps with some of the details. Those of you who are relatively new to Medicare might feel just a little bit overwhelmed by the details, but I don't want you to be. I just mainly want you to know how much there is to know. And you can always look things up later. You have the slides, there's always a place to go to fill in your knowledge when you have specific questions. But the main idea that I want to get across to everybody here today, and the reason I'm here and the reason I talk about Medicare, is that I want you to save your clients from making mistakes. Because a lot of people are making mistakes when they retire. They are either not signing up for Medicare on time, or they're doing it wrong, and nobody is advising them. This is what I learned, and believe me, this comes from personal experience. I started learning about Medicare when I was writing articles for Horse's Mouth about Medicare, and learning about the enrollment periods and the late enrollment penalties and the gaps in coverage. And it's not that easy to just sign up for Medicare. You have not finished the job when you've signed up for it. And so I learned about all these things, and then I started creeping up toward the magic age of 65. Actually, my friend Lori is 3 months older than I am, and a few years ago, she had her 64th birthday, and we went out for dinner, and I said, "Happy birthday, Lori. Next year you get to go on to Medicare." And she goes, "What? I don't know anything about Medicare. What is Medicare?" And of course she was offended, because we all are when we're not old enough for Medicare, but you know, we are. We're all getting there. So in helping Lori, what I discovered is not only do you have to sign up for Medicare on time, but you have to get supplemental insurance because Medicare doesn't cover everything. And she had been self-employed, paying $800 a month for an individual health insurance policy with a $1,500 deductible. She never even filed a claim because she was so healthy. But she was every month shelling out $800 a month. And when I got her onto Medicare, her health insurance cost went down to about $300 a month. So I immediately saved her $500 a month. Plus, of course, those late enrollment penalties that she would have incurred had she not signed up on time. I had another client, this is a self-employed attorney, who had a small practice. She had a small group policy, and when she approached 65, I said to her, you got to get onto Medicare now. And so, again, the same reaction. I'm not old enough, but oh yes, you are. So she called her insurance agent and wanted to make sure that she could still cover her employees if she went on to Medicare, and the answer was yes. And then she said, well, what do can you get me supplemental insurance? And they said, well, yes, but it'll cost you $1,000 a month. And she had only been paying, she had been paying $800 a month before. So they were going to give her a Med Supp policy for $1,000 a month, and I got her one for, $200 or something. So the point is that nobody is looking out for people's best interests. I talked to an insurance agent at a conference, and I said this to him. I said, nobody's telling people about Medicare. I said, why aren't insurance agents telling people about Medicare? And he said, it's not their job. So it is your job. You are all self-appointed Medicare ambassadors. And if you do nothing more than just alert people to the fact that they need to sign up for Medicare, you will have done a tremendous service for your clients. So we're going to get into the details here. If you have a question during the presentation, I would say if there's something that I say that is unclear and you want clarity on that particular thing, then raise your hand, come to the mic, and we'll address the question. Otherwise, there's a possibility that I'll answer your question sometime during the presentation. So we'll try to leave some time for questions at the end. And again, you're familiar with the drill, I'm sure. Raise your hand and come to the mic. Okay, here's what everybody needs to know by age 65. Medicare is not automatic unless they're receiving Social Security. If you're receiving Social Security, you will be automatically enrolled in Medicare Part A and B unless you decline. And I'll talk about the Parts A and B in a minute and the differences there. But the point is that it is not automatic for most people, especially your people who are continuing to work after age 65. Medicare is not free. Believe it or not, a lot of people think it is. You know, baby boomers, they're not giving thought to Medicare. They are thinking about Social Security, as we all know. They start thinking about Social Security starting in their late 50s or mid 50s. But Medicare is not on their radar until they get right up until the age that they need it. Medicare doesn't cover everything. That's another misunderstanding. People think, oh, I'll sign up for Medicare and all of my health care will be covered. Not true. If you don't sign up on time, you will pay more. There are specific enrollment periods, and they don't make a lot of sense, but they're there, and if you don't sign up on time, you will pay more. If your income is high, you'll pay more. There's this income-related monthly adjustment amount, which is a nice way of saying surcharge for high-income people. They will pay higher Medicare premiums. You don't have a choice. You have to be on Medicare. If you are over 65, retired, keyword here is retired, and want health insurance, you have to enroll in Medicare. And in a second, I'm going to cover those situations where you don't necessarily have to enroll in Medicare. But if you are retired, if you're not working, you have to enroll in Medicare. That's just the way health insurance works in this country. And it's a good thing. You know, sometimes people think, oh, Medicare is a government program. It can't be as good as private health insurance. Well, not true. I mean, Medicare is paid for by the government, but as far as getting health care, they get it the same way. They go to their same doctor. The doctor just happens to get paid by Medicare instead of a private insurance company. So other insurance policies are secondary to Medicare, except employer-sponsored group plans with 20 or more employees. We'll talk more about that. So here's the agenda. We're going to go fast. As I said, there's a lot to cover. What is Medicare? Who signs up for it and when? How do you sign up? How much does it cost? How can you help clients minimize their Medicare costs? That's what we're really what we're all about here today. Carolyn McClanahan, by the way, is a very good speaker. She has a talk on managing healthcare costs in retirement. I think it's the next one after this. It's really good. This presentation today focuses just on Medicare and how to minimize those costs. What does Medicare cover and what does it not cover? So what is Medicare? Well, it's a national health insurance program for people over 65, administered by the Center for Medicare and Medicaid Services, CMS, and enrollment happens through the Social Security Administration. Medicare was set up in 1965. There are two ways to have it, and this kind of blurry example just kind of illustrates how you can have Medicare. So you have your Part A and Part B. Part A covers hospitalization. Part B covers doctor bills and medical procedures. So you can have Part A and Part B, I can't even read this myself, and have your drugs covered by a separate drug plan, and then you get a supplemental policy to cover the gaps that Medicare doesn't cover. That's over on the left. That's called original Medicare or traditional Medicare. Or you can get your care through a Medicare Advantage plan. This is sort of like an HMO that we're all familiar with. So you sign up through the HMO and they just handle all the billing, and you pay a co-payment when you go in to get your medical care, and they cover drugs as well. So it's just like two different ways to do it. There are pros and cons to both, so you can't say one is better than the other. And we probably won't have time today to go into those pros and cons, but this is just, it's sort of a helpful graphic here to understand how people get their Medicare today. And the choice this is the choice that you make right off the bat when you're first signing up for Medicare. Do I do the original Medicare and get a drug plan and a supplemental policy called Medigap, or do I sign up through a Medicare Advantage plan? Who is eligible? Everyone over 65 is eligible for Medicare. That's pretty much everyone. Now, if you've paid into Social Security for your 40 quarters, you get free Part A. Don't have to pay for Part A. Everybody pays for Part B. And if you, so if you didn't get work your 40 quarters and you're not married to a person who work their 40 quarters. You can still have Part A, you just have to pay for it. There are premiums for that. Okay, so after age 65, Medicare is the primary payer, unless the client remains covered by an employer group plan that covers 20 or more employees. And this is one of the biggest areas of misunderstanding here, and the biggest question that comes into our Q&A forum and everybody else's is, you know, here's the situation, do I have to sign up for Medicare? So I'm still working, do I have to sign up for Medicare? Next question, are you covered by a plan that covers 20 or more employees? Then you can stay on that plan. The plan cannot force you to go onto Medicare. And this was part of TEFRA a while back. They made the rule that companies cannot discriminate against people over 65 by giving them a lower quality health insurance. They basically couldn't force them onto Medicare by giving them a bad health insurance deal at work. So they have to give everybody over 65 the same quality of coverage that they give everybody else, and those people can stay on that company plan, and Medicare is the secondary payer in that case. So when they go to the doctor, they submit the bill to their own employer health insurance first, and any gaps then are filled in by Medicare, which they may or may not want to sign up for Medicare. If they have a very comprehensive employer plan, there's no reason to really pay those Medicare premiums. They might as well just stay on the employer plan. But some people have both, and so it just depends on the situation. So everybody, but this is the other thing. So anybody who is not covered by an employer group plan that covers 20 or more employees must enroll in Medicare at 65. Otherwise, they won't have health insurance. So this includes small plans, your small business people have less than 20 employees, retiree plans, COBRA, and individual health insurance policies. One of the biggest mistakes we've seen people make is follow their employer's advice when they retire to go on to COBRA. This is the worst thing they can do. And the reason is COBRA goes for 18 months. They come off of COBRA. They have passed their initial enrollment period for Medicare, so they're now in the penalty phase. And they can't just sign up whenever they feel like it. They have to sign up during one of Medicare's specific enrollment periods, and that means they're going to go without health coverage for some period of time there. So it's a double whammy, and it's a terrible thing, and people don't know. They're just, you know, honestly following their employer's advice to go ahead and go on to COBRA, and it messes them up. So don't let your clients do that. What if you don't, oh, I'm sorry, yes?
So how does that interplay if you have a spouse that's covered on your employer plan and they're not working, do they still need to sign up for Medicare, or because they're covered on an employer's plan that they don't work for, do they qualify to stay on that plan?
They qualify to stay on that plan. They can. But as I also preach, when people turn 65, they should take a fresh look at everything. And especially in these days of stingier employer health coverage and high deductibles and things like that, everybody should take a fresh look. So if you have a spouse who's not working, covered on the spouse's plan, doesn't have to sign up for Medicare, but may want to. Just depends. Yeah.
Because how long it takes to get Social Security in force, if somebody waits until the last minute, COBRA might help them for a month or two because of how delayed.
Yeah. Good point.
Being on Medicare can take longer than anybody normally would expect possible. And COBRA might be able to fill that gap until you're in force.
Okay, good point. So COBRA can come into play there because to fill in that gap, that time gap, but don't let it go on for past the initial enrollment period. So what if you don't enroll in Medicare on time? Well, the worst part is that you may not have health care coverage. Some people, they're not aware. They think they're covered and they're not. And then there's that late enrollment penalty. So here's a chart showing coordination of benefits, who pays first. This just basically, what I just said, basically. If you've got an employer plan that covers 20 or more employees, the plan pays first, Medicare pays second. But if you've got a smaller group plan or retiree plan or COBRA, then Medicare pays first, as long as you're signed up. So the late enrollment penalty applies if the client is not covered by that group plan that covers 20 or more employees and does not sign up during his initial enrollment period, which is that 7-month period surrounding the 65th birthday. It starts 3 months before the birthday and ends 3 months after the birthday month. So that's what I learned when I was writing for Horse's Mouth. That was like the red flag. It's like, oh, there's this enrollment period. My friend Lori and I, 3 months later, have to sign up for Medicare during that initial enrollment period. That's when we have to sign up. Now, for your clients who are still working and covered by that employer group plan that covers 20 or more, they don't have to sign up when they're 65, as I've mentioned. They can wait. And then there's a special enrollment period. And that's a 7-month period. You want to make sure they sign up during that period. The second part, though, it's more about avoiding coverage gaps there. So if somebody is retiring, they've delayed Medicare because they are covered by the group plan, they retire at, say, age 70 or something, then you're going to want to make sure that they get their Medicare plan in place to take over when the group plan ends. So even though you have an extra 7 months to avoid the penalties, you don't want to take advantage of that. It's very easy to enroll in Medicare if you're receiving Social Security at 65. Parts A and B are automatic. You can decline Part A, or Part B rather. Coverage starts the first of the month that you turn 65, and Part B premiums are deducted from the Social Security check. If you're not receiving Social Security when you turn 65, and let's hope most of your clients are not, then you would sign up during a specific Medicare enrollment period. So these are the 3 main enrollment periods. Again, you don't have to memorize all these details, just be aware of them. That initial enrollment period is that 7-month period surrounding your 65th birthday. The special enrollment period for those people who delayed Medicare is after they retire, and then there's that general enrollment period, and this catches all the other people, the people who go, oh really, was I supposed to sign up for Medicare? And let's say it's, what are we in, January, so if they caught it now, they're lucky, because they're in the Medicare general enrollment period. They can sign up between now and the end of March, and coverage starts July 1st, so of course they would have a coverage gap there. But this general enrollment period is what catches all of the people who go, oops, was I supposed to enroll in Medicare? And if it happens in April, too bad, they're going to have to wait until January. So who signs up for what during the initial enrollment period? Well, almost everybody signs up for Part A, because even if you're still working, you can sign up for Part A because it's free. You know, we're assuming that everybody here, you know, your clients have all paid into Social Security or are a spouse of a person who paid into Social Security. So Part A is free. And so it offers very good hospitalization benefits, and there's no reason not to sign up, except for one thing, and I'll tell you in a minute. Part B is people who are not covered by the large group plan, and that means people who aren't working, people who are self-employed, people who are employed by small companies, on COBRA, retiree health insurance, or employed by a company or a spouse's company whose health plan is less comprehensive than Medicare. People, just because they don't have to sign up for Medicare at 65 if they're covered by a group plan, doesn't mean that they shouldn't. They might be better off signing up, going off that group plan and signing up for Medicare. You just have to look at the situation. Yeah? Is
there any
detriment to signing up for Medicare early? Well, you're going to be paying premiums, the Part B premiums, and then I'm going to talk about another little gotcha here in a second. Part D is for, it covers drugs, and this is for people who have signed up for Part A and B and want prescription drug coverage either now or in the future. There's another thing I learned when I was counseling my friend Lori and then myself. It's like, well, we don't take any drugs, you know. Why should we sign up for Part D? You have to. You have to, because if you don't, you're going to pay a penalty later on. The whole idea of health insurance is, you know, the principle, you know, you can't only sign up when you get sick. It doesn't work that way. And so Medicare works, under the same principle with both A and B and D. You sign up because when you're healthy, and that sort of subsidizes the people who are less healthy. Yes?
Does that mean that when I turned 65 and I signed up for Medicare Supplement Plus, which includes health coverage, someday I want to switch, say, to Medicare Advantage, I don't think there's going to be a penalty for part of it.
Okay, the question is, if I sign up for, let's talk about the original Medicare with a Medigap policy and a drug plan, and then let's say he wants to go to a Medicare Advantage plan. Is that what your question is? Is there a penalty? No. Because you were covered by a drug policy. Yeah. Could you go to the mic? I'm sorry. So I and everybody can hear you.
If you're on a plan with the 20 or more,
Yes.
do you have to, I've heard that you have to stay on that plan if you're still working. You can't come off and sign up for Medicare.
You
It's not
don't
an
have
option.
to stay on that plan.
You do not have to?
Right,
Okay.
you don't. You can go off of it and go on to Medicare. But you have to look at all the, all the ramifications. Generally, employer plans are a good deal. If your premiums are paid for by your employer, and that's why you have to look at all the costs and benefits at age 65. That's why I'm saying, if you get nothing else from this session today, it is this: everyone should evaluate their health care coverage at age 65, working or not. Just look at the options, including your own employer coverage, your spouse's employer coverage, and what you can get by going outside of employer coverage and going onto Medicare and getting putting together your own package. Yeah.
If you're on a plan with an employer plan of less than 20, and you maintain that plan, does that plan essentially become your supplemental and Part D coverage?
It can do that, but be careful of those plans, because what those plans are doing, they're essentially volunteering to be the primary payer. They're saying we will, and if you look deep into their documents, they'll say, if once the person turns 65, we will become the primary payer. They don't, but they're not obligated to be the primary payer after age 65, and so they could withhold that coverage. It's not a good idea. Okay. So the special enrollment period, as I mentioned, this is for when people are retiring and they have delayed Medicare past age 65 because they're still working. Then that special enrollment period starts. And then so as I mentioned, what everybody should do when they turn 65, if they're retired, they enroll in Medicare. If they're working for an employer with fewer than 20 employees, they should enroll in Medicare. And if they're working for an employer with 20 or more employees, including spouses, check the benefits and costs of that employer plan versus Medicare, plus the supplemental insurance. Can stay on the employer plan if it's more favorable, or can leave that employer plan for Medicare if that's more favorable. But either way, call Social Security, because here's the deal. If a person is given incorrect information and they are assessed late enrollment penalties, if that incorrect information came from Social Security, they can seek equitable relief. If that incorrect information came from an employer, from an insurance agent, from a neighbor, from a financial advisor, from anybody but Social Security, and if they are assessed penalties because of the actions that they took based on that advice, too bad. So that's why everybody should call Social Security, explain their situation when they're approaching, say, 3 months before age 65, and ask, do I need to enroll in Medicare? Yeah.
Did I understand from your earlier statement that if you just sign up and you have good employer coverage, that your Part A would be secondary for household age?
It would be, if you have 20 or more employees, then the Part A is secondary, right? Okay, yes.
How do you document that? Because how can they, go back to a phone call?
You just make notes. You just document it and you keep your notes. Yeah.
They won't respond to an email, I assume, right? Or
Yeah, no. Call them up. And, you know, not to say that they're going to get necessarily good advice from Social Security. You know, we all acknowledge that. But, excuse me, that's just, that's the way the game works. That's just what I have to tell you, you know. You can't rely on, nobody's managing this stuff. This whole healthcare system has gotten way out of control, as you all know. And so you just have to manage this stuff the best that you can. So again, the general, and just finishing up the enrollment periods here, we have the initial, we have the special, when you're going off of employment, and then we have the general if you missed the other. So how to sign up, very easy. Go to ssa.gov and click on that button, apply for Medicare benefits, or you call Social Security. Very easy to sign up for Medicare. But here's where it gets complicated, okay? Because Medicare is just, that's just Part A and Part B. It doesn't cover everything. You also have to have your drug coverage, and you have to fill in your gaps. So that's where you have to go out and shop for private insurance. And again, this is what I helped my friend Lori do and what I did myself 3 months later. It's a lot of work. It's more work than really financial advisors want to go through. And you don't necessarily have to do this with your clients, but you have to at least alert them that it has to be done and maybe make some referrals or whatever. But so here's how to sign up for Medicare Part D. You first decide if you want that original Medicare or the Medicare Advantage plan. If you're going with the original, then you shop for the prescription drug coverage, and then you apply through the private insurer or through Medicare. There is a drug plan finder on the Medicare website. It's very good. And you can go and put in your zip code and put in a few parameters, and it will give you a list of all of the drug plans in your area, and it's very helpful. Okay, here's the catch on when we talk about signing up for Medicare or not and Social Security and how it all gets convoluted. And here's the downside, one downside to enrolling in Medicare. If you're contributing to a health savings account, you can no longer contribute if you're on Medicare. And more employer plans now are health savings accounts, where either the employer is making the contributions or the employee, or partial, or whatever. But the employer plans are more and more offering health savings accounts paired with a high deductible health plan. And, you know, they're good plans. But if a client, and we're finding that now with Social Security, if a person files for Social Security, even if they suspend. So if you have that strategy where you're doing file and suspend at full retirement age, they're going to be automatically enrolled in Part A. And if they're automatically enrolled in Part A, they can no longer contribute to a health savings account. So we've done some analyses here, and it comes down to basically comparing the value of those Social Security benefits to the value of that health savings account. It's not a terribly complicated analysis, but it kind of depends on who's making the contributions to the HSA. If the employer's making the contributions, then it's a much better deal to stay on the HSA and forego the Social Security. If not, you know, the Social Security, that's a cash benefit. The health savings account, those are tax benefits. And so usually the Social Security is a better deal, even if the client has to go off the HSA. And, you know, I talked to one advisor for his own situation. He wanted to file and suspend so his wife could start getting spousal benefits. And he went to his employer and asked if they had a different type of plan other than the HSA. And they came up with like a FSA and combined with an HRA or something. Anyway, it was a little different plan, and he could continue to stay on that employer plan and get the Social Security. So this is just something for all of you to really, really monitor and be aware of. And, you know, because as you say, you're probably all seeing a kind of a pickup in HSAs, are you, among your working clients. So, okay. So if a client is participating in an HSA through an employer-sponsored plan that covers 20 or more employees, he can delay enrolling in Medicare and keep contributing to the HSA. So it is possible after age 65 to make those HSA contributions. You just can't be on Medicare. And you can't file for Social Security because that forces Part A. It's automatic and it's retroactive 6 months. And so some people have had to go back in and take those last 6 months contributions out to avoid the overcontribution penalty. So if the HSA is individual plan or less than 20 employees, then sorry, no HSA anymore after 65 because they have to enroll in Medicare to avoid those penalties. How much does Medicare cost? Well, there are a number of costs associated with Medicare. One is the premiums, the deductibles, and the co-payments or co-insurance. So the Part A premiums, most people don't pay these if they've paid into Social Security. So Part A is free, generally. But if somebody didn't pay in, these are what the costs are, $226 a month or $411. Don't memorize these things. These are inflation adjusted too. They change every year. The Part B premiums paid to Medicare. Now, the Part B premium, when Medicare started in 1965, the Part B premium was $3 a month. It was just like pocket change, and even then. And now it's up to, it's $121.80 a month, unless you were held harmless, which I don't want to really go into right now, but $104.90 if you were having your Medicare premium deducted from your Social Security check last year. There was no cost of living adjustment for Social Security, and so it would have caused the bump in Medicare premium would have caused people's Social Security checks to go down, so they held it steady for those people. But the important thing to note about this table is the income-related monthly adjustment amount. And these are the higher amounts that your clients will pay, you know, if they're still working. So it's kind of a conundrum for your people who are still working and having their high income. You know, their Medicare premiums are not insubstantial, you know. So this is something to be aware of. Then you have your Part D premiums. The Part D premium is paid to the drug plan. The average Part D premium is about $40 a month, and that's paid directly to the plan. You can find ones that range from like $18 to like $130 or something, just depending on the coverage. For my friend Lori and me, who are both very healthy and we don't take any drugs, we get the cheapest plan we can find. It's the Walmart Humana plan. It's $18 a month. And the thing is, you change your drug plan every year anyway. Each drug plan is good for a year at a time. And so if we contract some illness that, you know, requires us to take some expensive drug, then next year we'll sign up for a more comprehensive plan. But in the meantime, there's no reason to pay more than you need to. And there's also an income-related monthly adjustment for drug plans, and these amounts over on the right here, the $1270 and so on, those are paid directly to Medicare. So by the time you have Parts B and D, you're kind of getting up there, especially for your high-income people. $500 a month, you know, it could cost. I mean, this is still pretty reasonable compared to health insurance for 65-year-old people, you know, in the open market, but you know, still, it's not insignificant. So in addition to your premiums, you could have late enrollment penalties. Part A doesn't really apply because most people don't pay premiums for Part A anyway, so that's not a concern. It's the Part B late enrollment penalty that you have to watch out for. 10% of the premium amount for every 12-month period. You could have had Part B but didn't.
May I ask a question?
Yes.
Going back on the Medicare Advantage plan, are the Part B costs that you just illustrated for Part B and Part D, are they in addition to the
They are. They are.
Medicare Advantage premium?
Yes. Yes, the Medicare Advantage, that's the premium that the health plan charges to cover your services. Though that income-related monthly adjustment amount on those tables, those are charged by Medicare. And if you fall into that, one of those income tiers, you're going to pay those amounts to Medicare, regardless of how else, you know, whatever else you've got going on with your Medicare. So this part, this late enrollment penalty, I mean, if you wake up 2 years after age 65 and say, oops, I should have signed up, you're gonna pay 20%. If it's 3 years, 30%. And this is every year for the rest of your life. So adds up. And then there's a Part D, late enrollment penalty as well. So this gets more complicated. Just be aware that there are these penalties for people who don't sign up on time. There's also deductibles. Now Part A offers good coverage, but it does have a pretty hefty deductible here, which is $1,288 per spell of illness. Spell of illness is defined as so many days in the hospital. So you could actually have more than one deductible in a year's time if you're in and out of the hospital. The Part B deductible is pretty reasonable, $166 a year this year. These are also inflation adjusted, so these change every year. As part of the Affordable Care Act, the deductible is not charged for certain things, preventive services like flu shots or your screenings, mammograms, pap smears, bone mass tests, things like that. And then the Part D deductible is $360, but it depends on the plan. Part D plans are very, very complicated. They're all over the map. You've probably heard about the donut hole. I mean, they're very complicated. And you have to look at each plan and in the context of the drugs that you are taking or your client is taking, and this is why you want to send them off to do this. You don't necessarily want them to come to you with their whole list of drugs. Tell them where they can go, and they can. Medicare has a very good website where they can go, they can enter their drugs, they can enter their you through. A lot of advisors form alliances with health insurance agents who could be very, very helpful here because they know the markets, they know how things work, and if you find a good one that you can trust, they can really, really help your clients. So I would definitely advise that. Shop carefully for Part D plans. Studies have shown that the last one I read, it was like 90-some% of people pay more for their drug plan than they need to, just because they don't shop around. And they'll sign up for a plan, and then in September they'll get their packet in the mail telling them what their new plan terms will be for the next year. Usually those premiums are going up and the coverages are going down, and the whole drug formulary list has changed so that the message that they're taking, the drugs that they're taking are no longer covered or less covered. So just know that drug plans change every year, and they have to do a brand new assessment every year. So getting back to my friend Lori, when I signed her up, she picked, both of us picked the United Healthcare through AARP drug plan. It was $30 a month, which seemed pretty reasonable at the time. Then the next year they raised the premium to $45. And I had been, because I was on top of all this stuff, I saw that the same plan, United Healthcare, AARP, was coming out with what they called a Super Saver plan for $15 a month. So, of course, my plan was to ditch the $30 plan and go for the $15. Lori was getting all this stuff in the mail, and she thought that what she was getting was their sales material for their new Super Saver plan, but she thought she was all set up with her, you know, it was all the same mail from the same company, and why did she need to open this stuff? And she would have gone on and paid $45 a month, the new premium for the new plan, not even knowing that they offered a $15 plan. Sneaky stuff's going on out there, I'm telling you. You gotta stay on top of this. And then, of course, this is all your area, manage the income-related monthly adjustment amount. So the definition of MAGI for Medicare purposes here is adjusted gross income plus tax-exempt interest for muni bonds. So the income is taken from the tax return 2 years prior. So the premiums for this year, 2016, are based on 2014 income. And the other thing to know is that these are cliff brackets. So if MAGI is $1 over the threshold, the higher premium will apply. You can appeal the decision, and this does come up a lot, if there is a certain life-changing event that happened. So say somebody had very high income in 2014, then they retire, for example, and they get hit with a high premium for 2016, they can appeal, and loss of a job or reduction of hours, basically retiring, is considered a life-changing event that is grounds for appeal. So they can get that appealed. But if they take a big capital gain in 2014, sorry, that's not grounds for appeal. So just be aware of managing these income clients. When you get your notice every year, every high-income client will get a notice in November telling them what their Medicare premiums are going to be for the coming year and how they figured it, and then in that letter are all the instructions for appealing if they want to. So again, you want to just manage people's taxable income in the usual way, however you do that, through annuities or, you know, buy and hold stocks or, you know, qualified plans, whatever, the usual way. Muni bonds, of course, won't do it because the tax-exempt interest is added on to AGI to make up that modified adjusted gross income. Consider Roth conversions, but do it, you know, before. So do it preferably prior to age 63 so that that bump in income happens before it's considered for the Medicare premiums. Plan for those unusual income events and perhaps restrict that unusual income to just 1 year so they get hit with that high premium in only 1 year. Just bite the bullet for that year if they have to, but then it goes down later. And then be aware of those cliff thresholds. Part of your tax management. So what does Medicare cover? Part A is hospital, basically. Part B is your doctor visits and your outpatient services. These are all the things that are not covered by Parts A and B. Long-term care is the biggie. And most surveys, studies have shown that most baby boomers think Medicare covers long-term care. They think it does. We, of course, know it doesn't. So this is all part of your discussion with people when they are approaching age 65 and you're talking about Medicare. Make sure they know that Medicare doesn't cover long-term care. And then you see this list here of all the other things that are not covered by Parts A and B. So supplemental insurance is absolutely essential, and this is what makes the whole Medicare enrollment far more complicated than, you know, it would normally be by just signing up. You've got to fill in those gaps, the co-insurance, the deductibles, and so on. Yes?
Excuse me, if a spouse is under 65, does that person need to go on a separate plan, or can
Yes.
they be?
Yes, she does. You know. But yeah, that's something else that has to be managed. If the worker, the working spouse, retires and goes on to Medicare, and the wife is still covered by that employer plan, and can no longer be covered by that employer plan because the spouse has retired, then you have to find individual coverage for her through the marketplace, the healthcare marketplace. So just the thing to know about supplemental insurance, you need it, and it's confusing. And it just involves a big shopping trip. You just have to go out and shop for it. Yeah?
What do you do if you're traveling outside the country?
If you're outside the country, you can usually get emergency care if you have, you know, through your supplemental coverage. Medicare does not cover care delivered outside the country. So for your clients who are thinking about retiring outside of the United States, just know that Medicare won't pay for their coverage. Some people, though, they find that the coverage in their new country is better, and they don't have to pay as much. Yeah.
Is it different for government employees, retired government employees? Their coverage is the same?
They still, if they like TRICARE or some of those other plans for the federal employees, they still need Medicare. Yeah, they do. Okay. So Medigap policies. These follow specific laws. They are lettered A through, I don't know what the higher one is now, G or something. They all have to offer they're all standardized in terms of their benefits, but their costs are all over the place. And so this is another area where clients have to be really careful and shop very carefully, because a lot of people are paying too much. So there are certain things that Medigap policies don't cover either. Here's the list. Basically dental, vision, and hearing, all the things that you start losing when you're over 65, they don't cover. And so we have about 4 minutes left. I think, well, I'm going to skip through some of this because this is just how to shop for plans, which is much more complicated than we really have time to get into. Take a look at this slide here, which compares the Medigap to the Medicare Advantage, the pros and cons of each. Did you have a question over here? Yes.
If you don't sign up for Medigap in the first 6 months,
Thank you. Excellent. Yes, thank you for bringing that up. If you do not sign, you have an open enrollment period. This is like number 2 most important thing to take away from this session today, and thank you for reminding me. You have a 6-month period to sign up for a Medigap policy, and the 6-month period is when you are both 65 and have Part B. So if you're signing up for Medicare at 65, it's the 6-month period after age 65. If you want to buy a Medigap policy, they have to take you, regardless of your health status. If you're outside of that 6-month period, they don't have to accept you. If you're coming off of an employer plan, say you're 68 or something, and then you sign up for Medicare, it's that 6-month period that you have your Part B. This is really, really important because even for your healthy clients, they may not always be healthy. And so that's why you've got to get that coverage when you are able to. Now, it doesn't mean if you get denied by a Medigap policy, you can still get health care coverage, but you have to go into a Medicare Advantage plan. Medicare Advantage plans have to accept everybody. So you can still get coverage, but it may not be what really the client wants. So that's something very, very important. So that's it. Sum up by monitor existing insurance, ask all clients about their Medicare supplemental insurance. This goes on after age 65.